So we're going to roll the chest and the shoulder area with the softball. You can also do this with a lacrosse ball or a baseball, but the idea is Janella's going to lean into the ball, and she's basically kind of, think about digging in. She's looking for the pain spot in the front delt, it's the front of the shoulder, and even into the upper pec, right underneath the clavicle. And you may have to shift around a little bit depending on your chest size and your body structure. But the idea is to find those spots that are a little extra sensitive, a little extra tight. When you get to one, you can roll across it, or you can stop and actually just work on breathing. A nice big 3-second inhale maybe, and then a 6-second exhale. And just kind of breathe through it, try to get that muscle to release, and then move on to the next spot. Chest, shoulder, obviously work both sides. Okay, so we're going to go ahead and foam roll the lat. So what Janella's going to do is she's going to take that roller, she's basically going to put it into her armpit. So she'll go onto her side, and you're going to kind of wedge it up into the armpit. And this is kind of an awkward one for folks. What you really need to do is lift your body using your feet to get enough pressure into that ball. You can also kind of go forward and backwards. But the idea is you're going to essentially roll from the rib cage all the way up through the armpit, that's the lat, and even into the tricep you can actually roll into and just get nice and deep. And as you get better at this, you can do it in one smooth motion, but you really got to be patient with this one. It's also one that for some people, they lay on it and they immediately feel it in that lat, right up in that armpit area, boom, they feel it. Others, they're kind of laying there and nothing's happening. And that's where you got to kind of shimmy back and forth, forward and back, and then even use your feet to kind of lift yourself up and roll up that ball, up that side, down into the armpit and find that spot. And just like anything else when you're doing foam rolling, find the sensitive spots, roll it back and forth, or hold it and breathe through. Foam rolling the spine, working up and down the back. This is generally folks' favorites. They get some good crack-a-lacking going on here. But essentially what you're going to do is you're just going to roll literally up and down the full length of your spine, enjoying it. Put some weight into it. You do have to make sure that if you're wearing a hood or you got a ponytail, make sure you don't get sucked under. But you're going to roll all the way down to the lower back, and then all the way back up the spine, just below the neck. Again, watch your ponytail if you have one or if you're wearing a hood. And you can, even with this one, you can roll all the way up from the top of the spine all the way down to the bottom and even up into the glutes. So just shift your weight, find the spots. You may get some good cracks, they feel good. If you find an area, again, that's tender, sit on that spot, roll back and forth. Make sure with this one, though, you're also really paying attention to breathing. This is one that people tend to hold their breath on. You want to stop. You can stretch over the roller, leaning far back. Take some nice big breaths. And of course, you can do that the whole length of the spine as well. Really, just find some good spots and enjoy this one. The cat-cow stretch. Essentially what we're doing here is really working through the spinal range of motion. We want to get really super round in the thoracic spine. That's your upper mid-back area. We want to really work the lower, the lumbar, and get some good hyperextension there. So just take a look. I'm going to have Janelle actually just kind of run through it just to give you an example, and then I'll kind of talk through it. So there's that really good extension and then really flexing and rounding that spine. So with this, really taking it nice and slow and trying to feel like almost like one vertebra at a time, especially as you go into that top position when you're really kind of blowing it out and rounding. Now, one of the things I really like to do, so we're going to inhale here, lift the head up, and then really press hard through the hands as you exhale and try to get as high as you possibly can, and just imagine pushing through the ground and getting up as high as you can, and then relaxing into that down position. Really just getting some mobility through that spine. Okay, we call this the open book. So Janelle's going to go ahead and put one leg long, and then she's going to take the other leg and cross it over. Now what we like to do is have the knee actually on the ground. So she's going to lay in the position with the knee on the ground. You could also rest the knee on a foam roller, but the idea is the knee is going to stay stationary. We need one part to stay stationary. In this case, we're going to choose the knee down. She's holding it down with her left hand in this case. And she's going to go ahead and open as far as she can. Now, she's able to get her hand to the ground. A lot of folks, when they get this started, their hand is in the air. And they get a little confused, and they end up having their knee off the ground, so they get their hand on the ground. What we're going to do is we're going to have the knee stay on the ground, and we're going to rotate the hand only as far as we can go. Now you can hold this position and take really nice deep breaths. You may struggle with that if you don't have the flexibility, or a larger person might have a little bit of difficulty holding and actually breathing normally, 3 in, 6 out. So in that case, we'll have them actually go through the motion. So she'll inhale, bring her arm back, and then exhale as far as she can, let all of the air out, do it nice and slow, but then when you go ahead and inhale, you'll actually come back for the inhale. Sometimes that inhale in that stretch position can be really challenging. So either version is going to be great. Just go at your capability. Stick-ups. Love this exercise to kind of build the shoulder press pattern, but really to rehab a lot with a lot of folks with their shoulders to create some better mobility, okay? So first and foremost, can you get your arms flush against the wall, okay? So Janelle passes that test. You can keep her rib cage down. She's not arching to get back there. For many, this is it. I'm just going to open up and hold that position, stretch out that chest. The goal is to actually slide the arms up the wall without them leaving the wall and bring the biceps towards the ears. Now you're going to see Janelle's actually not able to do that because shoulders is one of her areas of weakness that we need to work on. So how high can we get? And then come back down. And just work that nice and slow as you're breathing. Exhale as you push up, trying to keep opening up the chest, getting some mobility, opening up these shoulders, and then come back down. It's slow, it's controlled. We're not forcing to get higher and higher. So really great exercise to warm the shoulders up, or to, again, work on creating an increased range of motion in the shoulders.